Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 24 new cases of COVID-19 in Windsor and Essex County. 14 are close contacts of confirmed cases, 5 are community acquired, and 5 cases are still being investigated. We have had 16,133 cases since the beginning of the pandemic. 362 people are active at this time, and to date, 1,435 preliminary or confirmed variants of concern have been identified in Windsor-Essex County, with 93% of these cases identified as having the UK variant. 3 cases have the South African variant and 4 the Brazilian variant. 20 people are currently in the hospital and 3 people are in ICU. Our community has lost 421 people to COVID. There are currently 6 active outbreaks in Windsor and Essex County, 5 workplaces, and 1 in the community. Regarding the vaccine rollout, 218,590 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 203,246 people have received at least 1 dose. Overall, 59.7% of adults 18 years of age and older in Windsor-Essex County have received at least 1 dose of a COVID vaccine. We will be moving to 18 plus in our booking system effective tomorrow at 9:30 a.m. We are also looking at increasing access to those 16 years of age and older who are essential workers. We will have further information tomorrow. Please book your appointment at wevax.ca or through the call center at 226-773-2200. We continue to ask people who have received their vaccine outside of Ontario to please visit our website and complete a brief questionnaire at wechu.org/cv/vaccine. If you have any questions, please contact the Health Unit at 519-258-2146. Extension 1285. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us today. Yesterday we achieved another significant milestone of vaccinating more than 200,000 residents of Windsor and Essex County, coming closer to 50% of all our residents, including children, vaccinated in our region. If we focus just on the adults that are 18 plus, we are almost at 60% coverage rate with at least 1 dose. We are inching closer and closer to the finish line, and I'm confident that if we continue to vaccinate at our current rate, we will have a good summer in Windsor and Essex County. Now that Pfizer vaccine can be given to anyone who's 12 years and older, we need to vaccinate roughly 270,000 of our residents to achieve the 70% coverage for 12 years and older in our region. We continue to see cases in our region, and as I reported in my EPI summary, almost half of our cases were in individuals under the age of 30. With many more opportunities to get vaccinated either through the mass vaccination clinics, pharmacies, primary care providers, pop-up clinics, we should vaccinate that group as well as in the coming weeks for anyone who is 18 years and older, and then 16 years for all the essential workers. Please note that the vaccine takes at least 2 weeks to generate the immune response, and everyone must follow the public health measures to keep themselves and their families safe. We need our case counts to drop down significantly and to have a very high coverage rate to open up in June once the provincial order is lifted. Please do your part to ensure that our region can safely open up with our high vaccination rate and low case rates. Another issue that I want to touch today is the type of vaccines that are available. Since the province is no longer giving out first doses of AstraZeneca vaccines, we only have 2 vaccines that are available, which is Pfizer and Moderna. Both vaccines uses the mRNA protein to trigger the immune response. I heard some individuals decline to receive Moderna vaccine and was looking specifically for Pfizer vaccine. I want to remind everyone that both Pfizer and Moderna works in the same way, and we have great success with both the vaccine. There is no preferential recommendation for one vaccine or the other. Both vaccines are equally safe and effective to generate the immune response that our body needs. The only difference is Pfizer is available to individuals 12 years and older, and Moderna is only available to 18 years and older. I want to assure you that there are no safety concerns or effectiveness concerns at this time with either of these vaccines. So please get your first shot that is available to you, regardless if it's Pfizer or Moderna. Lastly, I want to caution people attending the pop-up clinics in the region. It has come to my attention that some individuals who received the AstraZeneca vaccine and are going to pop-up clinics to receive a Pfizer or Moderna vaccine. I want to remind all those people to wait until we address the second dose issue for AstraZeneca vaccine. Right now, the mixing and matching of these vaccines are not yet recommended based on the limited studies that data that we have seen. We are anticipating some guidelines that will come in later this month or early next month regarding mixing and matching of these vaccines. So until that happens, please stay put and do not try to get your vaccine or try to mix it up your vaccine if you have received another vaccine in the past. So please wait for your turn before we come up with much more formal guidance. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Good morning, Doctor. Good morning, Teresa. With the expansion to everybody age 18 plus starting tomorrow, how many vaccines do you anticipate you'll be able to deliver every day or every week? Just an update on that.
So we know that this week our vaccine supply is about 17,000. So in a week we'll administer 17,000. We also have pharmacies that are receiving vaccine outside of that, and primary care providers. So with Moderna and Pfizer, we'll probably have in our area maybe another it's another few thousand of the Moderna as well. So probably closer to 20,000 in a week, each week for the next few weeks.
And separately, are you still vaccinating housebound individuals, recipients of chronic health care, or from the list provided by the LIN, or is that complete?
So I believe we're complete with the adult recipients of home care that are not able to leave their homes, and we've been completing that with Erie Shores Healthcare and EMS and our health unit staff. And we're also continuing to do some mobile clinics and go into specific home residential areas and do some targeted vaccines to people. So that continues, but the other group of about 300, I believe, are finished.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, you mentioned the percentage, we're almost at 60%. Obviously making lots of progress, and then also the milestone of 200,000 people, more than 200,000 people receiving at least one dose. I know the team has put a lot of effort into this, but just reaching these milestones in basically 5 months, I guess it puts a smile on your face, but like you said, there's still some work to do.
Yep, and I think I am, at least, and my team are hoping to give Teresa a wonderful present when she retires, and feeling confident that she has done her job to give the vaccine coverage to our community. She has been instrumental in everything that we have done. All the credit goes to her with regards to planning and everything that we have done to ensure that the vaccines are not staying here and is getting out as quickly as possible to the right people. So we're hoping that that will be her parting gift when she retires from here.
Teresa, I know you mentioned more information tomorrow in regards to the essential workers 16 and over. I guess, I'm not sure if you want to give us a hint, but are they going to be eligible to get the vaccine starting tomorrow as well?
Yes, so we're hoping to work in our booking system and to allow people 16 years of age and older to get vaccinated. So we're just looking at that right now. Our intention even last week was to look at a system but we were also wanting to make sure that we could move to 18 plus. So a couple things happening at the same time, but yes, so you'll hear more information, and it will be that we have a pathway for 16 plus as well to book online.
And one final one here, I'm not even sure if this might be for Mike actually, but is the health unit ready for this influx, I guess, on the website? I'm guessing there's going to be a lot of demand starting tomorrow. Is the server ready to handle this?
I'm sure it is, Rob. We'll do the best we can.
What are the wait times right now on the website if someone goes on there?
On the booking system or on?
Yeah, the booking system, sorry.
That I'm not certain of at this moment in time.
Yeah.
Okay, thank you.
Any questions from CTV?
Yeah, just wondering what the demand has been for the vaccine. I know that over the weekend, Vax Finder, there were a lot of tweets about empty slots. Are people booking as quickly as you thought, or have you seen a drop, or?
So I think we are still vaccinating close to 3,000 people a day, which is pretty good. And I think as more and more groups are added and the coverage rate is getting higher, we're not seeing the same surge as we were seeing it before, because your target population continues to shrink every day. So that's what we are experiencing, and as we continue to drop down our age to 18 plus, and hoping that that would give us the extra boost for anyone who's eligible in our region to receive the vaccine, especially with the long weekend coming up. We hope that by the end of this month, we'll be in a much better spot. So I'm not concerned at this time from a demand perspective, but I really want to request anyone who is eligible right now to get the vaccine. The more and more people are vaccinated, we can fight this virus off. We can stop the transmission. We can get back to our normal. It's absolutely critical that if you are eligible right now, please do not wait and get your vaccine as soon as possible.
Okay, and another question. When people have a first vaccine, so I'm just reading an email at the same time, can they ditch the mask like the CDC guideline?
Not at this time. Our Canadian guidelines continue to be the same, but we anticipate that in the summer that would change, and to reflect some of the realities and based on the coverage and based on the transmission. So at this time, no, you still have to follow some of these public health measures, and but soon enough we will be in a position to maybe give you a different message. But until we do that, please continue to do your part and continue to keep yourself safe and follow these measures.
Thank you.
Any questions from CBC?
Yes, good morning. I wanted to ask about your call last week to people who had been vaccinated outside of Ontario. Wondering what the response has been to your survey so far.
So I don't know the exact numbers, but I know we did get some questions, and so we kind of tweaked the survey a little bit. So it was some people had received their first dose here and then had received their second dose outside of Ontario. So we kind of changed the survey a little bit to make sure we captured that scenario. But I haven't talked to our EPI to see if there are enough people to report anything at this time, but we will be monitoring that. And like I said, we just made a little tweak to the survey to capture some of the questions we've been receiving. So people hopefully are continuing to go to our website and, you know, complete the survey and let us know if they have been vaccinated outside of Ontario. But a lot of the questions, you know, it generated some questions about, you know, how do I get my second dose, or, you know, what if it was the reverse? So anyhow, we'll we'll report on that when we get some more information.
Thank you. I also wanted to ask about a story we did about drive-in all-you-can-eat promotions from restaurants where your order gets brought to your car. Does the health unit have any, any concern with that from a gatherings perspective?
So it is something that we are looking at closely. I think there are some criteria that they are meeting, and from a gathering perspective, yes, you're right. But the understanding is they're eating in their car, and I've asked my team to take a look at the regulations to make sure that they are in compliance. So far, they haven't raised any flag, but we'll continue to look into it. And obviously, this is just one aspect, but there are other aspects of the Reopening Ontario Act that has to be met. So we'll be looking at it, and we'll, as I said, at this time, it is one of those areas that are almost like in the gray zone, and we'll be looking at it closely to make sure that we're not putting anyone at risk, and everything is followed under the regulations.
Thank you.
Any questions from Blackburn?
This may be looking ahead too far, but if demand slows down for booking appointments, do you have the authority to shorten the wait time between doses if you're noticing appointments aren't getting booked up once you open it up to all the different age groups?
So, interesting question. I can't say never, but I think we also want to make sure that we are consistent across the province as far as the policies are concerned. These are some of the policy decisions that comes from the province. We definitely want to vaccinate as many people as possible, as quickly as possible, both with first and second doses. But we have to be mindful of our supply. We also have to be mindful of the entire province as a whole, because we can't pretend that Windsor-Essex is safe and the rest of the province is still in the high risk area. So I can't say that it's completely impossible or it's always possible. So we'll have to wait and see. With the additional doses, I think, generally speaking, just like the second dose interval for the highest risk healthcare workers have been shortened, there may be some other opportunities to prioritize some of the additional groups, whether we're talking about 80 plus seniors in our community or 70 plus seniors living in our community, and or any other groups that would benefit from a reduced interval. So at this time, stay tuned. Never say never. We'll see how it goes in our region.
Thank you.
Any additional questions from the Windsor Star?
Yes, just to be clear, the announcement tomorrow about the 16 plus vaccine rollout, will that be specific to essential workers in that teenage age group, or would it be anybody 16 plus?
So the plan for tomorrow is that the essential workers who are working in grocery stores, fast food restaurants, that are 16, 17, 18, that they'll be able to book as an essential worker. So the age band overall hasn't decreased. It's the age, the allowance of people 16 years of age and older who are working to be able to access a vaccine.
Okay, thank you.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Yes, following up on my question from Friday, do you have any information to share about how many partially vaccinated people are getting COVID-19 and whether there have been any deaths among those who've either received 1 or 2 doses?
Not to our knowledge at this time, especially the death piece, but and I'm not sure about the reinfection or breakthrough infection with after receiving 1 or 2 doses. This is something that is right now, it's difficult to link it all together, but our team is definitely asking anyone who is a new case about their vaccination status. So I'll see what we can share, but right now it's a little bit challenging to link those two databases together for people who are getting the case and those who are vaccinated.
Thank you.
Any additional questions from Blackburn?
No, thank you.
Thank you, everyone. Have a great day.